This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, Daly, I hate this expression. I shouldn't say this, I guess, but it's always breaking news. There's breaking news about every 5 minutes in Harrisburg, particularly in June with the legislature and the governor. In effect, can I say, not always in agreement. But first, we're going to talk about the budget. We're going to get into some issues involving health care. One of the experts that we call in from time to time, Dr. Stuart Shapiro. He heads the Pennsylvania Healthcare Association. We'll talk about something calm, Dr. Stuart, the budget, given all the other considerations and issues that are before the legislature and the governor. You'll be the calming. You'll be the calming part of the program. All right. Let's talk about the budget and where it all goes. What's your sense? You've covered many budgets.
You know, you talk about breaking news. The budget is not about breaking news. Yeah. I once drove an 18-wheeler, and we went into first gear, and it lumbered into second and third. And during April and May, we've been in first, second. Now we're getting into third. Right. And just as we move into June and into the second half of June, we're getting into fourth and fifth and sixth gear. And we're moving into high speed. Right. And we're just going into that phase now. And there's lots of debates going on in the budget. And when the governor proposed his budget, there was a gigunda budget hole, $2.5 billion or so. Since then, the economy's improved, revenue collections have gone up, and there's still a small hole, but they're now getting down to brass tacks. Mm-hmm. And I know that they're going to work on a budget over the next several weeks, but I also know what is a good budget and a bad budget.
Right.
And I know that a budget that does not make seniors a priority is not a good budget. And I know a budget that does not protect the frail elderly is a wrong budget or a bad budget. And so we're hopeful, as an advocate for the elderly, that the legislature and the governor get together to make sure that the frail elderly, especially those who need to live with dignity in their later years, are taken care of. And the folks who are advocates for the elderly, the frail elderly, are saying very simply, Governor, legislature, you've got a $30 billion budget. Can we take an extra $40 or $50 million, which will bring in another $50 million of federal dollars? Mm-hmm. So we're talking $50 million against $30 billion. Can you do something because of the federal match to make sure that services to the frail elderly aren't compromised? So
your point is, as it stands now, you have then, as I take it, you'll correct me if I'm wrong, some concerns about the current budget debate that it might not include the 40 or 50 million out of, as you accurately point out, $29–30 billion. You have some concerns that that won't happen.
I can tell you that currently the state Medicaid program, which is run by very good people, under-reimburses cost versus what they pay for care, about $23 a day. They underpay about $8,000 a year for every elderly person on Medicaid in nursing homes. Nursing homes have been forced to now say, we can't take everybody who wants to come in on Medicaid because we can't afford to stay in business and take care of them. So people are traveling to distances away from their homes in order to get care. And costs have gone up 2.4% a year every year for the last 3 years. And what the advocates for the elderly are saying, people like me, people who are members of AARP, are saying, we need additional dollars to go to the frail and elderly. And if the state spends out of this budget $40 or $50 million, it'll be matched by the federal dollars, and then care can improve, more staff can be hired, more technology can be purchased, staff turnover can be reduced, more competitive wages can be paid, capital improvements can be made, and everybody will benefit. We ought to make sure that our elderly, especially our frail elderly, live with dignity.
Now, there are other things you would argue, and folks in the medical community in particular would argue, that drive up the cost of providing services to elderly.
Yep. And one of those is the tort cost. Do you remember back in 2002, doctors were leaving the state.
Right.
Malpractice insurance was becoming unaffordable. There were hundreds of frivolous lawsuits. Doctors were feeling beaten up. Insurance companies were making them settle for fear of going to court. And lots of money was leaving the state. Well, what happened is there was a law passed. There was some limits on punitive damages passed. Although people could sue and doctors and get whatever courts found appropriate, but there were some limits on the punitive damages. Laws were passed, the number of lawsuits dropped dramatically, and it all stabilized, and we're not losing doctors.
Right.
Same thing, same problem is now occurring in long-term care facilities, assisted living, personal care homes, and in nursing homes.
Can I interrupt you here for a minute?
Sure.
How many folks are in long-term care facilities, about approximately?
Probably about 130,000.
Wow, that's a lot of people.
But what's happening in this, and I know we only have a little bit of time, is these lawyers from out of state come in, and we've had 33 full-page ads in the last couple of months that are seeking to go after the employees, the nurses' aides in nursing homes, bring them in for depositions, harass them. And so there's legislation pending right now in the state legislature that's with the goal of driving some of the predatory lawyers out of state, especially two firms. But the critical problem is that with these lawyers comes extra cost. And last year, $150 million was spent on defending and making settlements to lawsuits. 90 million of that was paid by the state Medicaid program. 90 million. You remember a few minutes ago we talked about whether we could get 40 or 50 million dollars out of an additional funds to help care for the elderly. That's not a lot of money when you look at these boatloads of money that are going out of Pennsylvania to predatory lawyers.
So what can be done about it?
There's legislation pending right now. It's going through the Senate. We're very thankful to Senator Scarnati, Senator White, Senator Vogel for working so hard on this, to the entire Senate. Hopefully, within the next 60 days, a bill will pass the Senate, will pass the House, and the governor will sign it, because that will protect seniors from these predatory lawyers that are driving up costs.
In a couple sentences,
it says very simply that anyone can sue a nursing home or a personal care home the same way they can sue a doctor or hospital, but it says that you can't get unlimited punitive damages unless there is purposeful mistakes. And so lawyers in Pennsylvania don't go after punitive damages very much. But what this does is it does just what the Supreme Court says, is make a relationship so people are not blackmailed into lawsuits, into settlements like the doctors were. Once those limits were put on doctors, on doctors being sued for punitive damages and what those damages can cost, the number of lawsuits dropped against doctors. There were lots of meritorious cases that went to court, and people got what they deserved, but it stabilized the physician practices and made sure there was access to care. That's all we're asking.
All right, you'll keep us updated, and then at one point, as I said, we're going to have you come back. I want to talk about what seniors should do to prepare. Something I know, you get up there in age, you got to think about a nursing home, you got to think about assisted care. You're going to come in and tell folks what they should do to prepare for that, right?
Absolutely.